It's a fairly common surgery, sometimes to improve vision and other times to help people look younger and more rested. We're talking about the lower eyelid surgery. Dr. This is Dr. John McCann. He is here from the Center for Facial Appearances. And I was just talking to you, Dr. McCann, about how easy the surgery is. And this is one of your most common surgeries.
Yeah, I think the most common surgery I do is upper and lower eyelid surgery. I also do a lot of forehead lift and facelift surgery too. But when it comes to recovery, no matter what surgery you do on the face, the thing that limits the recovery from surgery is the bruising and swelling around the eyelids.
Right. And does that happen fairly soon after the surgery?
Yeah, really, this bruising and swelling begins during the surgery and is as bad as it's going to get by one day after the surgery.
All right, you brought a little fun thing to show us. This is the lid lift goggle that you use, and it's to help improve the recovery.
It is. I've been doing facial plastic surgery for about 22 years. In the first 15 years, I focused a lot on coming up with better surgical techniques to improve people's outcome from surgery. But 15 years into it, I felt like I was pretty solid on the procedure to do, and I wanted to figure out how to make the recovery better for patients. So to that end, we invented these goggles. The goggles reduce bruising and swelling 3 to 5-fold.
Do they? How does that work?
Well, they apply a gentle pressure around the eyes, and with a gentle pressure on the capillaries that get cut during surgery don't leak, and therefore you don't have a collection of fluid and blood. And also the goggles also make people more comfortable, and they give people a sense of security, like their incision sites are protected after the surgery.
Which is nice because it has, like, it's dark, right? So it does protect you.
It is.
Is it comfortable?
Yeah, so you know, when I first came out with the goggles, I felt like we were doing well on it. We even did some patient satisfaction surveys, and we found that between 85 and 90% of people were happy with what we were getting with the goggles. But I took very seriously the 10 or 15% of people who had concerns about the goggles, and I used their ideas to improve the goggles. So, like, one of the things I did with the goggles is we put this little strap on the back of them that has numbers, so we can adjust the size of the goggles for people's head. We have coated the foam with a special cover that keeps their skin cool after the surgery.
Oh, which is nice.
And the first day after surgery, you can't see through the goggles because you have to have some sterile pads against your eyes. But after the first few days, these pads can be removed, and the patients can still get the benefit of the goggles, but they can walk around and see. And it is dark, which is good for them after surgery.
Which is nice, and maybe even helps you sleep.
Yeah,
and after I have that surgery and wear those goggles, can I take them and ski with them later?
If you want to. If you want
I might do that. That surgery, how long does it take to do the lower blepharoplasty?
Upper and lower eyelid blepharoplasty is probably a surgery that takes about an hour and a half.
And that's upper and lower?
Yeah.
And who is it for? Do you want to improve your vision, look younger? Because you could do upper or lower, right? I
do both, yeah. Sometimes I have people, for their upper eyelids, they're getting the surgery done because they want to improve their vision, then it's covered by their insurance company. And other times we do it just to make people look younger and feel more relaxed. I think the most common reason people get cosmetic surgery done on their face is because their face is putting out a message to the world that's not consistent with how they feel. Like their face looks like they're tired and they don't feel tired, so they don't want to be putting that message out to the world. They want to get that corrected.
How funny. That's exactly what my mom said. She was like, I think I need to do something because I just look tired in pictures and I need to do something. But you said to do the eyes is one of the quickest ways on the face to really get the best results.
Yeah, in my own practice, most people will come in and get their eyelids surgery done, and then they may be back 10 or 15 years later to do a facelift surgery because the periocular region tends to age faster.
Gosh, those darn eyes.
Yeah.
But if you go see Dr. McCann, then you can look younger and feel better. You should go in and have a consultation if you're thinking about this, right?
Yeah, I would love it if people came in and had a consultation about lid surgery. I also was noticing they put up a graphic about how the goggles work, and they're really quite remarkable. The goggles reduce bruising and swelling 300 to 500%, whereas most of the common recommendation after surgery is that people use ice. And when they've done scientific studies on it, ice doesn't really reduce bruising or swelling or pain. It's just not effective.
And these do. If you want to find more information on that, you can go to lidliftgoggle.com, and Center for Facial Plastic Appearances.com is where you can find Dr. McCann. But yeah, get in there and get a consultation. Maybe see better, look younger, feel better. Thank you so much, Dr. McCann.
Thank you so much.
I'm going to try these on in the break.